Magandang araw po muli sa ating mga classmates, sa ating tagapakinig. Magandang araw po, Doc.
Good afternoon.
Ipagpatuloy po natin ang ating pagtalakay sa Jing Essence. Number 3 na po tayo. So, ito po yung pre-heaven essence. So, since it is inherited from parents at conception, pre-heaven essence can be influenced only with difficulty in course of adult life. So pre-heaven, yung ibig sabihin, ito yung mana from parents. Some say this is fixed in quantity and quality due to its interaction with post-heaven essence. It can be positively affected even if not quantitatively increased. So ibig sabihin po, yung mana pala nating enerhiya ay fixed ito. So yung free heaven essence po ay best way to affect positively. One's free heaven essence is by striving for balance in one's life activities, balance between work and rest, restraint in sexual activity, balanced diet. So ito po yung na-preserve siya kung ganun yung ating lifestyle. Any irregularity or excess in this sphere is bound to diminish the free heaven essence. So kung i-unbalance, pag ma-unbalance pang free heaven essence natin, kung halimbawa sobra tayong nagtatrabaho, hindi tayo nagpapahinga, ang hilig natin sa sex, tapos yung diet natin, kung ano-ano lang, hindi healthy diet, yung free heaven essence po natin ay madidiminish. But way to influence one essence positively is through breathing exercise. So and such exercise as Tai Chi, Yuan, and Qigong. So yun nakakatulong po yun. Kaya mahalaga pa lang itong mga exercise natin na ito gawin natin para at least yung ating free heaven essence kung nagagamit natin, matulungan siya na dumami uli. Yun. So yun yung isang mga pamamaraan pong gagawin. Ang post-heaven essence naman po, essence refined and extracted from food. So yung mga kinain natin and fluids, so by stomach and spleen after birth. So pagkasilang natin, syempre kakain do yung baby. Pag lumalaki, siya yung kumakain tayo. So yun yung post-heaven essence, nagiging post-heaven essence. Sa newborn baby po, it starts taking nourishment and breathing. Its lungs, stomach, and spleen start functioning to produce qi from food, drinks, and air. So free heaven essence originates from parents at post-heaven essence originates from food. So malinaw po yun ang free ay galing sa parents at ang post ay yung mula sa mga kinakain natin. So yung post-heaven essence, ito po ay complex of essence, refined and extracted from food, is collectively known as post-heaven essence. Ito yung postnatal qi. Because stomach and spleen are responsible for digestion of food and transformation of food essence, ultimately leading to production of qi. So ito yung post-heaven essence is closely related to stomach and spleen. Ang nagpo-produce po ay ang stomach and spleen. So, not a specific type of essence, but simply a general term to indicate essence produced by stomach and spleen after birth, as opposed to pre-heaven essence, which is formed before birth. So, ang post ay ang pre-heaven essence is formed before birth, then ang post after birth. So, for this reason, stomach and spleen are known as root of post-heaven essence and kidney as root of pre-heaven essence. So, yun yung role ng organ natin na dalawa. Stomach and spleen sa post and kidney ay sa pre-heaven essence. So, kidney essence, more specific kind of vital substance which play an extremely important role in human physiology. So, derived from both pre-heaven essence and post-heaven essence. Like pre-heaven essence, it is hereditary energy which determines person's constitution. Unlike pre-heaven essence, kidney essence interact with post-heaven essence and is replenished by it. So, kidney essence, partake of both pre-heaven and post-heaven essence. So yung nakalagay na yun sa kidney po natin, malaking bahagi talaga ang ginagawa ng kidney. It's stored in kidney, but it also circulates all over the body, particularly in the 8 extra vessels. Determine growth, reproduction, development, sexual maturation, conception, pregnancy, menopause, and aging. So, andun yun sa ating kidney essence. So, differences between essence and chi. Essence is primarily derived from the parents before birth, while chi is formed after birth. Essence is replenished only with difficulty. Chi can easily be replenished on a day-to-day basis. Essence follow very long cycles of 7 or 8 years, whereas chi follows briefer cycles, some yearly, some circadian, some even shorter. Chi moves and changes quickly from moment to moment, whereas the essence changes only slowly and gradually over long period of time. Kasi nga kung gumalaw ka, diba? So yung chi mo, pwedeng nauubos yan, na nagagamit. Pero pag kumain ka minsan, yung mapapalitan uli. Pero yung essence na nakatago sa kidney, dahan-dahan lang siyang lumalabas. Yun. So function of essence. So growth, reproduction, and development. So basis of kidney chi. Siya din po yung producer ng ating marrow. Tapos basis of constitutional strength. Basis for the 3 treasure. Essence, chi, mind, jing, chi, and shen. So, yun po yung function ng essence. Thank you po.
Thank you very much, Ma'am Mildred. So, if you have any questions, feel free to ask them now.
Parang habang pinag-aaralan natin yung Dok, talagang parang ingatan natin ang kidney.
Yeah.
Ano po? Napakahalagang part talaga. Andun nakatago yung essence.
Totoo. Kaya tuloy-tuloy natin to, no? And we're learning a lot from it. Okay, thank you very much po. After foundations, we will now proceed to tongue diagnosis. Let's welcome Ma'am Teresita Sumile. Ma'am Teresita, good afternoon.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis, and now let's talk about the continuation of the topic yesterday, tongue body shape. Partially swollen tongue body shape. Although a total swelling of the tongue always indicates dampness or phlegm, a partial swelling may indicate other pathologies such as qi deficiency, qi stagnation, or heat. The areas where a partial swelling is most commonly seen are the sites in the liver or chest area, the tip, and the front third. A swelling on the sides in the liver area is very common and usually indicates liver heat. It is nearly always associated with a red color in the same area. A swelling on the sides on the chest or breast area generally indicates either retention of phlegm in the chest or breast or lung qi deficiency. Okay? Ito po ay ang itsura ng swelling of the liver area. Swollen po ang whole sides of the tongue body indicating liver heat. Okay? Ito naman ang itsura ng swelling in the chest or breast area. Only the sides of the anterior third is swollen. Okay? A swelling of the tip of the tongue, usually associated with a red color, is very common and indicates heart heat or heart fire deriving from severe emotional problems. A swelling of the front third of the tongue indicates retention of phlegm in the lungs. Okay? This is an illustration of the swelling of the tip of the tongue. Only the tip of the tongue is swollen, which indicates heart heat or heart fire deriving from severe emotional problems. Okay? At ito naman ay swelling of the front third of the tongue indicates the tension of phlegm in the lungs. Another picture of swelling of the front third of the tongue indicating lung problems. Okay po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. If there are no questions, we will proceed now to diagnosis by interrogation. And let's call on Ma'am Vina Pasqua, straight from Baguio. Good afternoon po, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, continuation po ito kahapon. Ito ay feeling of cold, day 14, acute fever po. So, ito yung 4 levels po ng in a nutshell. So, dito, alam na po natin itong defensive chill level, may fever, aversion to cold. Pag chill level naman po, may fever, feeling of heat, at nakakaramdam ng pagkauhaw. Sa nutritive chill level po, nagkakaroon po ng lagnat sa gabi, may mental confusion, maculae, and then sa blood level naman, nagkakaroon po ng fever sa gabi at saka mental confusion, maculae at saka may bleeding na po. Dito po yung may heat sa lungs, so nasa chill level na. Clinical manifestations, lagnat, inuubo na may yellow sputum, pinagpapawisan din, thirst, nagkakaroon po ng feeling of oppression or pain sa chest. Ang kulay po ng kanyang dila ay pula na meron pong yellow sticky coating. At ang pulso po ay rapid overflowing. Ito yung isang pattern na nag-a-appear po sa chill level within the 4 levels po. It is characterized by acute interior lung heat. From a Western perspective, it could correspond to acute bronchitis, pneumonia, o kaya'y pleurisy. Pag sinabi po natin pleurisy, ito yung inflammation of the sheet-like layer that cover the lungs po. So, in this case, merong actual fever as well as an objective hot feeling of the patient's body. Then, punta naman po tayo sa phlegm heat in the lungs. So, sa chill level pa rin, clinical manifestation, may fever, may cough, abundant po at a sticky yellow sputum, thirst, sweating, a feeling of oppression of the chest, nausea. Kulay pula po ang dila with sticky yellow coating. At ang pulso po ay rapid slippery. Ito po yung this is one of the possible patterns appearing at the chill level within the 4 levels po. It is characterized by acute interior lung heat na may phlegm. Then next po naman ay heat in bright young channel pattern. Ang clinical manifestations, may fever, sweating, sobra po yung pagkauhaw, big or overflowing pulse, pula ang dila at saka yellow ang coating. This corresponds to acute interior heat in the stomach channel, and its manifestation are described by the stomach heat level po within the 4 levels or the bright young channel pattern within the 6 stages. Ang pattern po na ito ay karaniwan summarized in a nutshell as ito po yung sinasabing 4 big. That is high fever, intense thirst, profuse sweating, at saka overflowing or big pulse. Yan po yung 4 big. Then ang last po ay heat in the bright young organ pattern. Clinical manifestations, may fever, abdominal pain, and fullness. Tuyo po ang stools, may constipation, thirst. Again, pula po ang dila with a thick, dry, yellow, o maaring brown or black coating. Ang pulso po ay deep, full, rapid. Ito po yung dry heat in the intestines level within the full levels po. And ito po yung parehas sa bright young organ pattern within the 6 stages. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Okay, any questions? Feel free to ask them now. Okay. Kung no questions, we will proceed to pulse diagnosis. We shall continue with the right middle pulse or the right middle position, stomach and spleen pulse today. Okay. So next we talk about the fine pulse. A fine quality on the right middle position is common. It indicates spleen and stomach deficiency. If it is fine, deep, and very slightly wiry, it indicates stomach ulcer. If fine, deep, slippery, and rapid, there is damp heat in the stomach and spleen. Next, we go to slippery pulse. Slippery quality indicates dampness or phlegm. Dampness may affect both spleen and stomach, but phlegm only affects the stomach. Okay? If the pulse is slippery and full, it indicates phlegm in the stomach. If slippery but weak and soft, it indicates chronic dampness in the spleen. Soggy pulse. This is also common. It indicates chronic dampness in the spleen. It is seen in post-viral fatigue syndrome. Hollow pulse. Hollow quality indicates bleeding in the stomach. If the pulse is hollow and rapid, so there is a forthcoming stomach hemorrhage, no? Yeah, check your pulse, your middle pulse. So we have here a summary. Pag floating, stomach heat, G stagnation in the stomach, or stomach deficiency. Floating but empty at the deep level. So if we have a wiry pulse, G stagnation in the stomach, rebellious liver chi invading the stomach. Both middle positions are wiry. Eating too fast, possibly hiatus hernia, wiry on the distal portion. Weak spleen chi deficiency, prolapse of the stomach. Weak on the main position, slightly wiry on the proximal side. Stomach deficiency is characterized as weak floating hollow. Pag stomach ulcer, weak and slightly wiry. Deficiency of stomach and spleen, deep, weak, deep, slow, both middle positions. Pag fine pulse, deficiency of stomach and spleen, stomach ulcer, fine, deep, and very slightly wiry. Damp heat in the stomach and spleen, fine, deep, slippery, rapid. Slippery, dampness or phlegm in the stomach. So that's slippery full. Pag spleen, slippery weak. Soggy, chronic dampness in the spleen with spleen chi deficiency. Pag hollow, ang pulse sa middle position, there could be bleeding in the stomach with forthcoming stomach hemorrhage. That's hollow rapid. Thank you very much. If you have no questions, we will now proceed to differential diagnosis. And let's welcome Ma'am Nix Yu. Good afternoon, Ma'am Nix.
Good afternoon, Doc Hector. How's my audio, Doc?
Very clear po.
Thank you. Welcome to TCM Foundations, number 179, Liver Chi Invading the Spleen. Okay? So, ang etiology, emotional strain. Yun yung anger, frustration, resentment. Yan. Yan talaga nakapagkasakit. And then, irregular diet and overwork. Underlying and accompanying pathology, stagnation of liver chi, spleen chi deficiency. Okay? Possible presenting condition, irritable bowel syndrome. Sign and symptoms, irritability, headache, may bitter taste, may oppression in the chest and hypochondrium, may abdominal pain or distension after eating, alternating diarrhea and constipation. Yung stools can be dry and table-like or loose. May flatulence and mayroong tiredness. Ang pulse kapag pinalpate mo ay wiry on the left and weak on the right. Okay? Ang tongue kapag tiningnan mo ay normal color or slightly red on the sides. Treatment principle, calm the liver, harmonize middle burner, supplement spleen chi, regulate intestine. So, acupuncture treatment points. Bladder 20 regulates spleen. Liver 14 harmonizes liver and regulates the chi. Liver 3 harmonizes liver chi. Ren 6 or CV6 fosters original chi. Spleen 15 moves chi, regulates intestines. Triple warmer 6 or Sanjiao 6 regulates chi, moves stool. Spleen 6 regulates liver, supplements spleen. Okay? Liver 13 harmonizes liver and spleen. Spleen 3 harmonizes central burner. Gallbladder 34 harmonizes liver chi. Stomach 25 regulates large intestine. Ren 12 or CV12 supplements the spleen. Stomach 36 supplements stomach and or spleen chi. And pericardium 6 harmonizes middle burner. So, ang technique ay needle with drainage or even method. Okay? Thank you very much. I hope you learn from here. Thank you.
Thank you very much, Ma'am Needs. So, I think maraming nakaka-relate po dyan, no? Liver chi invading the spleen. This is actually very common in the clinic. Next, we go now to acupuncture patterns and practice. Can we call again on Ma'am Mildred?
Yes, Doc.
Her topic is about stomach ache. Good afternoon po ulit, Ma'am Mildred.
Good afternoon po muli sa ating lahat. So, acupuncture patterns, practice, stomach ache. Stomach ache. The ancient knew stomach ache or epigastric pain as heart pain. It must be distinguished from true heart pain, which originates in the heart. Etiology and pathology. Stomach ache mostly arises when the patient overindulges in raw, cold foods or excessive spices, or in irregular in hunger and satiation. In such circumstances, the spleen stomach may be injured and their chi impeded. Stomach ache may also arise when pent-up rage injury the liver. Anxiety and bloating injure the spleen. Stagnant chi damages the stomach, or stagnant chi transform into fire and soars the interior. If spleen yang is chronically deficient, so that endogenous cold is formed, then attack by exogenous pathogenic evil can prevent central yang action and lead to imbalance in stomach chi activity. Though stomach ache is caused by the organ of the stomach, it is intimately related to the liver and the spleen. The liver prepares to function without restriction and govern conduction and facilitation. If liver chi moves abnormally due to obstruction of its normal paths, then the wood elements become too strong and can overwhelm the earth elements. So, yung cycle po nila, no, from the liver to spleens o cycle. So, if the liver chi moves abnormally, bumalik na ako. If the liver fires blazers, it can source and damage stomach yin. If liver blood becomes static, the stomach loses its nourishment. Thus, illnesses of the stomach are frequently related to dysfunction of the liver. The stomach and the spleen are both the basis of postnatal acquisition and the houses of storage. They complement each other in physiology. The stomach governs the reception and the composition of foods and drinks, and prepares harmony and normal descending in its function. The spleen governs the transformation and transportation of the essence derived from foods and drink, and prepare normal ascending and raising. In pathology, to the stomach, the spleen are complementary and affect each other, where excessive fatigue or exhaustion induces internal injury or cycle of hunger and satiation are irregular. In most cases, the spleen and the stomach are similarly affected. So from the liver to the stomach, yun yung sa co-cycle po aapektuhan niya. Pent-up rage and other passion. So pag may anxiety po, brooding, rage, and emotional depression, ay maaaring mag-lead sa liver blockage or magkakaroon po siya ng liver stagnation. So, failure of the liver function to conveyance and dispersion. It is attempt to move liver qi, follow abnormal path, and may attack the stomach. Overpower niya yung stomach. So, impedance of movement of qi and blood also lead to pain. Moreover, because of the interference of qi and blood, if qi impedance persists for a long time, it may lead to blood stasis. Blood stasis in turn causes blockage of meridian. Okay, makakaramdam na po ng sakit. As a result, magkakaroon ng aggravation of pain at magkakaroon po ng hematemesis, hematosia, and other bleeding. If qi is stagnant for a long time, it may also transform into fire. So, siyempre pag matagal na pong nag-stack, iinit na. So, magkakaroon na po ng of fire of the Zhang viscera. Magkakaroon ng liver fire. Is the most violent. Pag nagkaroon na po ng liver fibrillars upward and source liver and stomach yin, so magkakaroon po ng producing long-lasting and unremitting pain. So yung heat, papasok na po from the liver to stomach. Kaya yung matinding kirot po ang mararamdaman, sakit. So ang dietary and excretion po, excessive indulgence in food and drink or irregularities in the cycle of hunger and satiation can easily injure spleen and stomach. Kaya kung irregular po yung pagkain natin, na apektuhan po yung energy ng spleen at saka stomach. So excessive indulgence in raw and cold food can lead to cold accumulation of the stomach cavity. Halimbawa, yung mahihilig po sa, diba, iinom ng sobrang lamig na galing sa ref, kakain ka ng mga sobrang malalamig na pagkain, masisira po yung energy ng stomach. In this in turn, impairs the movement of qi and blood in the stomach and produces pain. Overindulgence in fats, sweets, and spicy food or in alcoholic drinks can lead to dampness and heat blocking the middle jaw. Kaya tinatanong natin sa pasyente kung mahihilig sila sa matataba, sa sobrang maaanghang, sigurado po ang spleen stomach nila ay magkakaroon ng karamdaman. Heat in the stomach also produce pain. These are all commonly seen in clinical practice. So innate and other deficiency. Innate weakness of the constitution, chronic fatigue, persistent internal injury, yung matagal na nagkakasakit, tapos inappropriate medication can also cause spleen and stomach deficiency. Halimbawa po yung mga tao ngayon, di ba, yung gumagaya-gaya sila na umiinom ng gamot kahit walang reseta ng doktor. Nakakasira po yan ng energy ng stomach, spleen stomach. Deficiency cold in the spleen and the stomach leading to impaired action of yang and middle jaw can produce stomach ache. This is frequently precipitated by attack of the exogenous wind cold or dietary indiscretion. So nagkakaroon po ng blazing fire due to yin deficiency, leading to insufficiency of spleen qi, and blood depletion also produce pain. This is frequently precipitated by pent-up passion or overindulgence in dry and hot foods. Yun. Naalala ko po, yung matatanda, para daw humaba ang buhay, huwag kang kakain ng mas sobradong mainit na pagkain kasi ang sabi nila, ang stomach mo, ang bituka mo ay masusunog. Yun po yung mga observation na matatanda nun. In general, the key pathological mechanism of stomach ache is stagnation of stomach qi. Stagnant stomach qi fails to harmonize and descend, and the impairment movement produces pain. So pag hindi na normal yung galaw talaga ng bituka, sasakit siya. The pathological change may be deficiency or strength nature. The mechanism of strength illnesses causing stomach is stagnation of qi in the middle jaw. So, stagnant qi transforming into fire, or stagnation leading to blood stasis. So, pag hindi po nakakadaloy yung energy, yung trabaho ng stomach natin na mag-transport, yan po ang pwedeng mangyari. Magkakaroon ng fire or magkakaroon ng blood stasis. The mechanism of deficiency illness is yang deficiency of spleen and stomach or accumulated heat enduring yin. However, deficiency in strength often transform into each other and are often intermixed. So yung clinical manifestation po nito, ang principal symptom is pain in the epigastrium. So pwede pong yung pain ay dull, distending, stabbing, vague, or acute. Dull or vague pain is particularly common. The pain is often accompanied by epigastric or abdominal distension, full erectation, acid regurgitation, nausea, vomiting, anorexia, and constipation or watery feces. There may also be lassitude, weakness, a sallow complexion, emaciation, or edema. Okay po. So yun po ang mga nangyayari sa ating spleen stomach. Thank you po.
Thank you very much po, Ma'am Mildred. Next, we go to signs and symptoms. Let's call on Ma'am Teresita Sumile once again. Good afternoon, Ma'am Teresita.
Good afternoon po ulit, Dr. Hector and classmates. Signs and symptoms, and let's talk about plaque, dry, and white teeth. Stomach heat. Signs and symptoms are plaque, teeth yellow at the junction with the gums, thirst, foul breath, burning epigastric pain, sour regurgitation, nausea, excessive hunger, a feeling of heat, red tongue with a yellow coating, overflowing rapid pulse. Then another pattern is heat in the stomach and kidneys. Signs and symptoms are plaque, teeth yellow at the junction with the gums, burning epigastric pain, thirst, sour regurgitation, nausea, excessive hunger, foul breath, a feeling of heat, dark urine, painful urination, backache, red tongue with yellow coating, and the pulse is overflowing rapid. Next is kidney yin deficiency. Signs and symptoms are plaque, teeth dull yellow at the junction with the gums, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, dry mouth and throat at night, lower back ache, ache in bones, nocturnal emissions, constipation, dark scanty urine, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, normal colored tongue without coating, and the pulse is floating empty. Next is dry and white teeth. Acute interior heat following an invasion of wind heat. There is white, dry teeth, feeling of heat, fever, thirst, sweating, red tongue with yellow coating, overflowing rapid pulse. Next is stomach heat. Signs and symptoms are white, dry teeth, thirst, foul breath, burning epigastric pain, sour regurgitation, nausea, excessive hunger, a feeling of heat, red tongue with a yellow coating, and the pulse is overflowing rapid. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita.
Ma'am, Doc, inisip ko lang po kung paano maramdaman yung dry teeth. Ibig sabihin yung yung saliva niya, hindi, wala, kunti din. Kaya nagda-dry?
Yung teeth lang.
Dry po yung teeth.
Paano
po kayo
natin malaman, Doc, na dry teeth tayo meron?
Siguro konti nga po yung saliva, kaya dry yung pakiramdam, pati yung teeth.
Makikita mo naman sa una-una, syempre yung tongue. I think pag dry, tinandaw natin ulit yung
Halos siguro nagka-crack na rin yan, po. Pero parang maganda kasi white. White dry teeth.
Maganda kahit dry basta white.
Oo.
parang ngipin close up.
Hindi siya nag-yellow, hindi nag-yellow yung teeth. So mas white siya.
Kasi dito, tinan nyo, yung tongue talaga magsasabi, red tongue with yellow coating. So there's too much heat.
At saka overflowing rapid pulse. Siguro nga. Basta may dry teeth.
Okay. Any other questions? Okay. Let's now proceed to the last but not the least topic, still on asthma. Today, we will talk about atopic eczema. This is common. Eczema from a very early age or even from birth often accompanies or precedes the development of allergic asthma. The two conditions of eczema and asthma have the same allergic root, as is easily demonstrated by the whealing skin reactions occurring on the inhalation of allergens in individuals suffering from extrinsic asthma. From the point of view of Chinese pathology, eczema is also due to inborn deficiency of the lung and kidneys' defensive G systems. The relationship between the lungs and skin is well known. So if there is a problem with the lungs, you will always see something on the skin. When discussing the pathology of skin diseases, Chinese books always seem to stress more the role of blood and liver in connection with the skin. In the case of atopic eczema and asthma, the connection between the lungs and the skin could not be clearer. These two symptoms are very clearly related, and often one will appear as the other improves. For example, eczema appears first at a very early age or even from birth, to be followed later by asthma when the child is about 4 or 5 years old. This is more likely to occur if the eczema is suppressed with the application of cortisone creams. Kaya wag lagyan ng so can you imagine, meron siyang eczema first, and then pag nilagyan mo siya ng mga creams, mga steroid, cortisone creams, tinatago siya. So lalabas siya ulit.
Parang mabablock, Doc, yung paglabas nung heat sa skin, kaya yung lungs ang maapektuhan.
Yes, kaya tapos ano na naman, gamot na naman. So,
Opo.
the reverse may also occur. Let's say lumabas una yung asthma and then apparently improves only to be followed by eczema. So, syempre gagamutin siya kung may asthma. So, if people will only realize na meron na po tayong acupuncture for this, no? So there is a very close relationship between the lungs and the and the skin. So particularly the lungs defensive Qi system and the skin. Now, next is the kidneys. Meron din siyang role sa eczema. First of all, while the lungs control the skin in the sense of being linked to its pores, remember, close open, the kidneys nourish and moisten the skin. Okay. Second, the kidney essence is closely bound with the corporeal soul or the po of the lungs, which manifests on the skin and which is responsible for sensations of itching and pain on the skin. An inborn defect of the kidney essence, such as in atopic asthma and eczema, can therefore affect the corporeal soul and the skin. Third, the extraordinary vessels, especially the penetrating or Chong and directing or Ren vessels. So remember, Chong and Ren, they nourish the skin through a network of secondary vessels all over the body. Because these two vessels arise from the kidneys and spread the kidney essence to the skin, they provide a further link between the kidneys and the skin. So we have an expert, Li Jishan, in a study of the 8 extraordinary vessels published in 1578 says, when the qi of the channel overflows, it flows into the extraordinary vessels. So, where this is turned into irrigation, warming the organs internally and irrigating the space between skin and muscles externally. Yun. The penetrating vessel also moistens the skin. Okay? If the blood of the penetrating vessel is abundant, the skin is moist. Also, ang skin pigmentation, nagdidepend din po siya sa extraordinary vessels. So I think we need to also take up yung mga extraordinary vessels. So this is,
Yes, Doc.
yeah, kasi parang, practitioners just ignore them no? Yung
Kaya
ani,
Doc, yung dalawang needles lang yung
yung
ginagamit na left and right.
totoo. Yeah. So, that is why ang darker pigmentation po is concentrated lang along the pathway ng directing or yung tinatawag na this is Ren and penetrating. So Ren and Chong. Directing is Ren, penetrating is Chong. Such as the genitals and the midline between the pubis and umbilicus and nipples. The pigmentation on the midline between pubis and umbilicus, this is the Ren, no? Midline often becomes darker during pregnancy. So another example naman ng relationship between kidneys and skin is the development of nephritis from a blood infection deriving from a skin disease. Okay,
Ay,
connected pala ito.
Oo. Kaya pala do kaming mga babae, may line po dito from the pubis hanggang dun sa umbilicus. Kapag minsan nga pag isesesaryan ka po yun yung ini-slice.
Tapos
Wala yan.
umiitim. Now you
Opo,
know.
umiitim po siya pag buntis. Pag
So dapat
nakapanganak na yung maglalait na po siya.
so dapat pala ayusin si Ren pati si Chong.
Opo.
Si Ren Chong.
Kaya lang kung yun ang
kaya
nai-slice
pala.
pag nasesaryan do, affected na siya, na ano na siya.
Oo. Yes, oo, barado na. Another example ng relationship. Okay. So ang problem kasi nito, like some people or most people, hindi nila na makita na connected yung nephritis from the skin disease. Okay. So, let's now summarize the kidneys and the skin. The kidneys nourish and moisten the skin. So if the skin is dry, so medyo May problema, no? Kidney essence is closely bound with the corporeal soul of the lungs. And nakikita po ito sa skin. And this is responsible for itching and pain on the skin. Okay. An inborn defect of the kidney essence, katulad ng atopic asthma and eczema, can affect the corporeal soul and the skin. So the extraordinary vessels arising from the kidneys and spreading the kidney essence to the skin, especially the chong and ren, nourish the skin through a network of secondary vessels all over the body. Okay, so when the chi of the channels overflows, it flows into the extraordinary vessels. Okay. Then it is turned into irrigation, warming the organs internally, irrigating the space between the skin and muscles externally. So the penetrating vessel moistens the skin. Skin pigmentation depends on the extraordinary vessels. So I think we need to focus on the EOV. Nephritis from a blood infection may derive from a skin disease. There are two basic types of eczema in babies. One characterized by wind heat called dry fetus. The other characterized by damp heat, damp fetus. They are both due to deficiency of the lung and kidneys defensive G systems, but with varying degrees of involvement of the lungs or kidneys. Okay, the wind heat type is more due to the lungs. The mild damp heat type is more related to the kidneys. Eczema from damp heat. There is skin lesions that are moist, oozing fluid, red and itchy, with the itchiness more confined to specific parts of the body, usually the forearm and lower leg. Please remember that in eczema, there is always dampness, even in the dry type. The typical skin puffiness seen in eczema is a manifestation of dampness. Okay, so let's talk about wind heat eczema. Dry, red, and itchy skin lesions. Remember red. While, dry and red, with the itchiness being spread all over the body and moving from place to place. Damp heat eczema, there is fluid, moist oozing fluid, red and itchy skin lesions, with the itchiness being more confined to the forearm and lower leg. Yan yung damp heat eczema. In eczema, there is always dampness, even in the dry type. So the typical skin puffiness in an eczema is a manifestation of dampness. So let us compare wind heat and damp heat eczema. So wind heat, the organ involved is the lungs. And clinical manifestations, dry skin lesions, red, itchy, itchiness all over, gumagalaw siya, nagta-travel, moving from place to place. Yung damp heat, the organ is kidneys. Moist skin lesions, oozing fluid, itchy, itchiness confined to specific parts, usually the limbs. Share. O, diba? Any questions? Is everyone excited now?
Doc, pag ano po, alam mo nagkakaroon ng eczema pero na-allergy sila sa sabon, ibig sabihin pa rin mahina yung weiqi po ano, kasi kahit may external na gano'n na may sabon kang nahawakan, hindi maapektuhan yung skin mo kasi kung malakas yung iyong protection po ano.
Yes. Yung kidney and lungs, defensive chi.
Opo.
So, with that, we would like to thank everyone for joining. If you have no more questions, okay? So, see you tonight sa ating 8 to 9 p.m. Zoom. Good evening, everyone.